So if someone's out there right now and they're like, oh man, I've got the flu, at what point should they consider consulting a physician?
Yeah. Number one, let symptoms be your guide. So some people have had flu before and they know what it's like and they're like, yeah, I feel okay. Signs and symptoms to be worried about is double sickening. So double sickening is a phenomenon that's classically described in sinusitis. I got sinus pressure. I'm blowing my nose. I got better and then I got worse again. What that's denoting is you had a virus that started to get better, but because we're coated with more bacteria in us and on us than our own cells, those bacteria have a perfect petri dish now because all the mucosal membranes are now inflamed. That allows for that secondary bacterial infection. So an influenza person who by day 4 is feeling great, but then day 5, they all of a sudden are getting fevers again, or they're hawking up a ton more phlegm, whereas before they weren't, that is a phenomenon in which they may be now getting a secondary bacterial infection. Speaking of which, a lot of the secondary bacterial infections, one of the top killers for bacterial pneumonia is something called strep pneumo, and there's vaccinations for that as well. So that increases after flu. So does staph pneumonias. Those are really, really nasty pneumonias. Those increase in prevalence after flu. And so other things that can also be a trigger for seeking medical attention is any individual who has underlying heart or lung disease who is feeling those symptoms worse than before. So a top trigger for getting COPD exacerbation. COPD is chronic obstructive pulmonary disease. Very common causes is smoking or environmental exposures. A lot of our veterans have environmental exposure as well as smoking. And so if they are feeling fine with their inhalers, they're breathing fine, and then they feel like they've got the flu, but their breathing is really being tipped over, it may not be the virus itself. In other words, it's not an actual inflammation from the virus, but it's triggering an exacerbation of an underlying disease. We know now, and a lot of the studies were done at the Brigham and Women's and at our VA by a lot of our cardiology team in noting that there's increases in heart attacks in individuals who have the flu. So an individual who's older, who has cardiovascular risk factors or has a history of coronary artery disease or heart attacks, if they're having respiratory symptoms plus chest pain, or respiratory symptoms plus bringing up a ton of phlegm, or respiratory symptoms plus new onset swelling in their legs, anything that's a bit unusual for something than a common upper respiratory nasal congestion, that would be something to get medical attention for.
So it's maybe not even necessarily that it's the flu that you have to worry about, but different things
downstream,
things that the flu can trigger.
Yeah, it is yet another example of sort of a ripple effect. So it's the insult to the body that now can increase what we call the physiologic stress. So a 20-year-old again who gets the flu is going to feel crappy, may not want to go to school, but their heart can tolerate the fast heart rate. Their lungs are healthy, and if they have a little twinge of some mucus that's in there, they're not going to have too much trouble breathing. But any infectious disease is inherently a stressful event, more stressful or less tolerable to extremes of age or individuals that have other diagnoses that can't tolerate, oh, now we have a virus on top of that.
Hey folks, connecting with your benefits is our primary mission, and the SITREP is providing more options than ever.
Subscribe to our free email newsletter, subscribe to our audio podcast channel, or subscribe to our content on YouTube.
For details and links, check out the description below.